Did you know that ovarian cancer, often termed the silent killer, affects thousands of women globally each year? Understanding this disease is not just crucial, but potentially life-saving. With late diagnosis often leading to devastating outcomes, it's time we break the silence and arm ourselves with knowledge. Today, we're taking a deep dive into the world of ovarian cancer, its causes, symptoms, treatments, and how to navigate life with it. This video is your roadmap, your guide, designed to transform your understanding and perspective on this significant health issue. We're not just talking facts and figures, we'll delve into real stories, the human side of this illness, giving you a complete and insightful picture. Stick around to empower yourself and help change the narrative around ovarian cancer. Ovarian cancer is a type of cancer that originates in the ovaries, which are the reproductive glands found only in females. This disease occurs when the cells in the ovaries develop mutations in their DNA, leading to abnormal growth. These cells multiply rapidly and erratically, resulting in a mass or tumor. Ovarian cancer often goes undetected until it has spread within the pelvic and abdomen, which can make it more challenging to treat effectively. Now, let's talk numbers. As per the World Health Organization, ovarian cancer is the 8th most common cancer among women globally and the 7th leading cause of cancer deaths. In 2020 alone, an estimated 313,959 women were diagnosed with ovarian cancer worldwide, and about 207,252 succumbed to the disease. That's a high mortality rate, signifying the urgency to discuss and understand this silent threat. Knowledge and awareness can be life-saving weapons against this disease, making this conversation crucial for every woman. Ovarian cancer doesn't discriminate, but some factors can increase your risk. Age is one significant risk factor, as ovarian cancer can occur at any age but is most common in women ages 50 to 60 years. Family history is another critical factor. Women with close relatives who've had ovarian cancer are more likely to develop the disease. Certain genetic mutations such as BRCA1 and BRCA2 also increase risk. However, it's important to dispel the misconception that only those with a family history of the disease can get ovarian cancer. That's not the case. Any woman can develop ovarian cancer regardless of her genetic background. Time for a trivia break. Can you guess what percentage of ovarian cancers are found at an early stage? Is it A, 20%, B, 40%, or C, 60%? Think about it, then leave your answer in the comments. The causes of ovarian cancer are not entirely understood. There is ongoing research studying various potential causes, including the impact of hormones, certain types of virus, and lifestyle factors like diet and body weight. However, having a risk factor or even multiple does not guarantee that you will get the disease. It only indicates a higher probability, and in many cases, women who get the disease have no known risk factors at all, which again highlights the necessity for awareness and regular checkups. By understanding ovarian cancer, we take one step forward in our collective battle against this silent killer. Let's continue our journey and remember, knowledge is power. As we continue this enlightening journey together, please take a moment to hit the like button if you're finding this information valuable. Don't forget to subscribe to our channel for more insightful content, and remember to check out the description box below for valuable resources. Your engagement helps us in spreading this crucial awareness to more and more people. Let's get back to our discussion. Diving deeper into our discussion, it's vital to recognize the symptoms of ovarian cancer. Unfortunately, early-stage ovarian cancer rarely causes any specific symptoms. However, as the disease progresses, women may experience bloating, pelvic or abdominal pain, difficulty eating, or feeling full quickly. More infrequent signs might include fatigue, back pain, changes in bowel habits, and unexplained weight loss. If you have been experiencing these symptoms more often than usual and they persist for weeks, it's time to consult with a healthcare professional. Now, it's crucial to understand that these symptoms do not definitively indicate ovarian cancer. They can be common in other less serious conditions. Yet, the persistence and frequency of these symptoms are key indicators that something isn't quite right and that you should seek medical attention. Spotting the signs early significantly impacts the prognosis of ovarian cancer. In fact, according to the American Cancer Society, when diagnosed and treated in the earliest stage, the 5-year survival rate is a promising 92%. Unfortunately, only about 20% of ovarian cancers are detected at this early stage. This underlines the critical importance of being in tune with your body, noting any changes, and not hesitating to seek medical advice. Ovarian cancer, much like an unsolicited intruder, enters silently but leaves a devastating trail. The earlier we spot the signs, the better equipped we are to handle it. Remember, vigilance and early detection are the most potent tools in our arsenal against this silent adversary. We'll be moving on to treatment options next, but before we do, think about how you can use this knowledge. Perhaps it's time for a routine checkup, or maybe you could share this information with the women in your life. After all, awareness is the first step towards prevention. Now let's shift our focus to a crucial aspect of our journey: prevention and treatment. Ovarian cancer might seem like a looming threat, but remember, we're not powerless. Armed with knowledge, we can reduce risk and fight this disease head-on. Preventing ovarian cancer isn't about completely eradicating the risk, as that's currently impossible with our scientific knowledge. However, certain lifestyle changes can reduce your risk. A balanced diet, regular exercise, and maintaining a healthy body weight are first steps you can take. The World Cancer Research Fund states that around 5% of all cancers are due to overweight and obesity, so maintaining a healthy weight does have an impact on cancer risk. Regular checkups are also key. They provide an opportunity for early detection, even in the absence of symptoms. Now let's delve into the treatment side of things. If diagnosed, you're not alone in this fight. Treatment for ovarian cancer typically involves a combination of surgery and chemotherapy. Surgery aims to remove as much of the cancer as possible, while chemotherapy kills any remaining cancer cells. This dual approach is often effective, but remember, each case is unique and treatment plans are tailored to the individual circumstances. It's also worth noting that research is always advancing in the fight against ovarian cancer. Just recently, a groundbreaking study published in the New England Journal of Medicine showed a promising new treatment using a class of drugs called PARP inhibitors. This represents a significant stride forward and offers renewed hope. We're not suggesting that the journey with ovarian cancer is easy. It's not. But with prevention strategies in place, a multi-pronged treatment approach, and constant advancements in research, there are weapons at our disposal. This fight isn't one-sided, and every step we take brings us closer to a future without the fear of ovarian cancer. So far, we focused on the medical aspects of ovarian cancer, but let's move the lens a little and shine some light on the emotional journey that accompanies this diagnosis. Living with ovarian cancer is a test of resilience and courage. It can feel like you're walking a path shrouded in uncertainty, but remember, this is a journey you do not walk alone. In our effort to bring this often silent struggle to the fore, we spoke with Elizabeth, a brave woman living with ovarian cancer. She reminded us that courage isn't always a roaring lion. Sometimes, it's a quiet voice at the end of the day saying, "I will try again tomorrow." She emphasized the significance of positivity and resilience, the power of a hopeful spirit in the face of adversity. And there's more to Elizabeth's story. She didn't just tell us about the hardships, the treatments, the anxiety. She told us about the incredible support system that has been a beacon of hope in her life. The family, friends, healthcare professionals, and even online communities who have been her rock. Because that's another key aspect of living with ovarian cancer, the value of support systems. This leads us to another vital aspect, the importance of mental health support and community involvement in a person's journey with ovarian cancer. Dealing with a cancer diagnosis is as much a mental challenge as it is physical. Feelings of fear, anxiety, and despair are common, but remember, there are resources to help you cope. Mental health professionals, support groups, and community organizations can provide a safe space to share your experiences, seek advice, and find comfort. In conclusion, living with ovarian cancer is a complex journey that involves a balancing act of managing medical treatments and maintaining emotional well-being. It demands resilience, and it underscores the importance of support systems. But above all, it's a journey that is walked together, not alone. In understanding this, we hope to paint a more comprehensive picture of ovarian cancer, one that acknowledges the challenges but also emphasizes the incredible strength and resilience of those who face them. As we draw to a close, remember, you are not alone in this fight, and together, we can make a difference. Don't forget to check out our other videos for more insightful content, and thank you for watching.